I'm sure we can all recall a memory when we met someone for the first time and it didn't quite go to plan. The awkward hi, followed by silence, or maybe you forgot what you were supposed to be talking about. In this video, we're going to talk through some different ways you can build rapport quickly in a way that feels authentic, focusing particularly on times when you're interacting with a patient for the very first time. Consultations for Health, helping you progress in communication skills to optimise the care of your patients. To start with, we're going to concentrate on why first impressions matter in healthcare and are crucial to building rapport. Then we'll move on to Hello, my name is. And next, we'll talk about the different ways to add some extra information to help your patient. And finally, we'll show you some example phrases to help with maintaining a patient-centred approach. All of these points will be focused in a way to help build rapport quickly and to hopefully avoid any awkward situations. Let's get started. Why do first impressions matter in healthcare? It's known that it takes just 0.1 second to create a first impression, and we already recognise the importance of this in normal life. We see its importance clearly when talking about job interviews and within new relationships. First impressions are important because you want to make sure the other person has an accurate idea of who you are and what you value. This is to help build a genuine connection quickly. This is what makes first impressions crucial within healthcare. We use the first impression to start to build a trusting relationship with our patients within a matter of minutes rather than over weeks or a year. As a result, a bad first impression may not be able to be improved if you only see your patient once or twice within a hospital stay. So if the first impressions matter so much, how can we give a good first impression to a patient? To give a good first impression often comes from focusing on the patient directly and putting yourself in their shoes. And one area which is often overlooked is a simple hello. Dr. Kate Granger, MBE, the founder of the Hello, My Name Is campaign, experienced firsthand how poor communication left her feeling isolated and disregarded during her cancer treatment. She states on her website that she firmly believes it is not just about common courtesy, but it runs much deeper. Introductions are about making a human connection. They begin therapeutic relationships and can instantly build trust in difficult circumstances. We have already talked about the importance of the Hello, My Name Is campaign on this channel. Check out the link in the description below. The next thing we suggest to adding to Hello, My Name is to add some information which makes it clear about your responsibility for that particular patient. One example is to follow it up with your job role. For example, hello, my name's James and I'm your pharmacist. We feel that this is an important aspect of an introduction because when we think about our patient's place within the healthcare system, it is likely that they're not just interacting with one healthcare professional, but they may be interacting with several healthcare professionals. Other ways to add useful information may include explaining to your patient why you're talking to them. From your patient's perspective, they may have never met you. They may not know what you do in the healthcare system, especially with less traditional roles like physician's associate. You may have just jumped in from nowhere and for a reason they're unaware of. For example, a pharmacist may say, I'm here to talk to you about your medicines. Asking, is now a good time, can help to show our patients that we understand that they have other things going on in their lives other than just healthcare. This helps to show our patients that we can empathise with them, build better rapport, but it also allows us to deliver better patient-centred care. Like when a patient may be waiting for a call from a family member, or they may need the toilet, or they might just be focused on something else. Although this may not always be appropriate based on urgency and the patient's condition.
Hi, my name's Sophie. Is now a good time to talk about your medicines?
But when used appropriately, clarifying if it is a good time to have a chat, especially in non-urgent situations, can help you address your patient's concerns in an order that matters to them. To keep our care patient-centred and show compassion, we should check that the patient can give consent and is comfortable with us continuing with our role. We should give our patients chances to say no if they are able to do so. This is where you will need to empathise with your patient, since you will need to try and know if something may make them uncomfortable without the patient verbally telling you beforehand. For example, doing a physical examination may make some people feel uncomfortable, especially if it is performed without asking for consent beforehand. And again, we should give them an option to say no and change the circumstances to help them feel more at ease. There are many ways to show empathy and build rapport with a patient in your first interaction. We've covered some of the easier ones to fit into your consultation without disrupting your professional agenda too much. However, we find that being natural and not overthinking your interaction will lead to you showing the best patient-centred care to your patients. You, the viewer, are 100% likely to be human, which means that even when we don't want to, we feel emotions. And if you're a healthcare professional, you already have compassion for people, so let your compassionate side show in a professional yet natural way. Here's some different approaches. I'd first like to ask you a couple of questions about the injury. Is that okay? Do you mind if I take a seat and we have a chat? Was there anything you wanted to talk about before we get started? You seem a little frustrated. How can I help you? Is it okay if I check your... Would you like me to close the curtain before we get started? We hope you have found some of these examples helpful, and we'd like to end with what we recommend you do next, which is practice. Whether that's in front of a mirror, with peers, recording yourself, or with real patients. The best introduction is a natural one, and by trying out some of these phrases and creating your own introductions, you can build up some sort of muscle memory, so even when you're feeling stressed out, you'll still have a bulletproof first interaction to quickly build rapport with your patients in the future. Thank you for watching Consultations for Health. Feel free to check out our Facebook, Twitter and other YouTube videos. Don't forget to like, comment and subscribe for future videos. And remember, keep practicing.